Welcome everyone to Let's Talk. This is the show on life, love, health, different discussions. And today we're going to talk about a epidemic that is occurring in the African American community of sickle cell anemia disease. This is something in my practice of working with clients, which is a very important thing that we need to talk about is occurring in our community, but also the form of treatment that is needed. Sickle cell is one of a disease that we deal with in our community, but we're still trying to identify sources of treatment to help those that deal with the chronic pain. And living with chronic pain in itself is a whole different experience, and therefore different modalities and different treatment is often warranted to assist in balancing out some of the needs that occur physically, mentally, and even spiritually. So today I have some wonderful guests on the show. Dr. Sheree uh, is a wonderful clinician. I have had encounters with her and working with some of her clients, from assisting with alternative holistic modalities to deal with pain. And we have Ms. Kiana will be joining us. And she is a dear friend, but also someone who is dealing with sickle cell and has a journey of her own personal experience. And we never know what people are walking around with day to day. And she always has a beautiful smile on her face. But I know from sharing her journeys and experiences, it's a lot more to it. And so I'm looking forward to us having this discussion. So if anybody, you can tune in. If you have questions, you can submit them in the comment box and I will answer them or allow our guests to answer them. So first, I'm going to bring on our first guest. And I doctor, and I keep saying now. So Dr. Watkins is joining us today. Yes. So if you a brief over, this is a dear angel. I don't even know how we connected, but somewhere in there in our journeys of wanting to address the needs of the clientele of dealing with sickle cell from a more holistic approach. But if you would just let the viewers know more about the sickle cell, why is it of such concern, particularly in our community at this time?
Well, good afternoon, everyone. I'm Dr. Sheree Watkins. I currently work at the Sickle Cell program, adult program here at Levine Cancer Institute here in Charlotte, North Carolina. And I've been working with our adult patients here for about 4.5 years. So my role is to be an addition to our medical personnel who provide the medical component to our patients. And my job is to provide the psychosocial component, which is basically looking at, our heart and our head. And so why is this of such importance to the Black and Brown community? So sickle cell disease is a hematological disorder. It is an inherent hematological disorder, not something that is contagious, but something that is inherited from two parents. And so when we look at some of the stats, we know that it typically affects 90% of African Americans and those of African descent here in the U.S. and abroad. So it's not something that is small in numbers. It's been something that has been studied and looked at for many, many years. However, when we look at some of the other chronic diseases that are currently out there in the US, we can see that the flourishment of treatments and modalities has not been as pervasive or as quickly as we've seen for some others. And so we know that through sickle cell anemia, one of the major components is that the healthy red blood cells begin to sickle in the process, which therefore they're traveling along inside of the body. That sickling process, once again, because they're of a sickle shape or a crescent moon shape, can become lodged in different areas of the body. So you can think bone, tissue, muscle, organs, all of those can be affected by it. And one of the most common incidences when it comes to that is what we call your pain crisis. So when those sickle cells bunch up in a certain area, it can cause a decrease in oxygen. It also can cause pain. And so we have what our patients report as pain crisis that they endure that can last from a few hours, sometimes to a few days or weeks. and there are many methods of treatment for it. And our goal is to always keep the patient at home, utilizing homeopathic medications or even procedures such as warm baths, massaging, wrapping up in layered clothing, hot showers, those types of things, over the counter medications such as ibuprofen or Tylenol, depending on the patient's current medical history, is also something that we're looking at too. However, because we know that these adults have been living with sickle cell since birth, they have learned to endure chronic pain since they can remember. So we do have a number of patients who do take opioid medications to treat their chronic pain disease or symptoms as part of their sickle cell disease. What is so significant about that is that we know that through the last few years there has been an opioid crisis, and that has greatly affected many of our patients who are once again prescribed and take opioid medications for their pain crisis. And it's difficult because, as you heard me mention, 90% of our patients are African American. We do also have about 2% who are Hispanic. And so, when our patients are going into the hospitals or the emergency rooms, they oftentimes can experience discrimination and racism of various forms from everyone from the nurse to the doctors, and they're questioning the legitimacy of their pain. They're questioning the legitimacy of the intensity or severity of their pain. And so we have to oftentimes, unfortunately, educate our patients on correct ways to sometimes go into the ER. No one would think that they would necessarily have to wear certain clothing and not wear other certain clothing, such as jogging pants and a hoodie, when going to the ED if they're in pain. But our patients oftentimes have to think about not only their pain, but also how they will be viewed once they walk into the local hospital and EDs. So many of them will wear, regular jeans and t-shirts or suits to the ED, and makeup sometimes, just depending, just to make sure that they're looked at differently compared to others who may be what we call drug-seeking behaviors or drug-seeking people.
Mm-hmm.
And the difficult part of that is that we know through multiple studies that have been done, like in the past, let's say 15 to 15 years, that there is a distinctive bias when it comes to doctors and African American people. They've done multiple studies to show that there is a bias and myth when it comes to doctors' belief that Black people, we can endure pain at higher levels than white people. That the ability of Black people to be in as much pain is not as um, pressing as compared to other races. But we also know that on the opposite side of that is that we as Black people and adults, especially with sickle cell, they're less likely to go to the doctor because they're in pain. So by the time they're in the ED or coming into the hospital, they're typically worse compared to their counterparts. So they're sicker. And so that
Mm.
means that they're typically in the hospital longer than someone just going through other types of treatment. So the average days of hospitalizations for our patients can range between 7 and sometimes up to 21 days, 28 days in the hospital. We've
Mm.
had some being there for 2 or 3 months. It just depends on what brings them in. But our goal is always to keep them out the hospital. It is our goal to try to make sure they can have the best quality of life. It is always our goal to make sure that for those who don't want to use opioid medication for their chronic pain management, that we create a holistic treatment plan that is conducive to their needs. And so, with this opioid crisis, we know that we are having to constantly educate our patients and doctors and nurses on the correct terminology of what actually is addiction or dependency. What's the difference between dependency and tolerance? Because oftentimes when they're labeled drug seeking, it's not because they're addicted to the medication. They are dependent upon the medication because they've been taking it since they have been 6 months, 1 years old, 2 years old. And there's a distinctive difference between those terms. So when we're looking at tolerance, it is the body's response to taking the medication um, after repeated use. That's the basic, simplest definition that you can have. Dependent says that after that first use, and your body has experienced that medication, whether we're talking from pain medication to Tylenol, that means that in order to have the results that you're looking for, so some type of relief of pain or relief of something, that
Mhm.
means that you have to continually take it over time. And over time, you may have to take more and more and more. So when you have that as far as activity, that's called dependence. So therefore, if you're not taking the medication and you abruptly stop due to various issues, that's what we call withdrawal. So that's a distinctive difference between tolerance and dependence and addiction. Addiction is the inclusion of all of those that I just mentioned, and also is drug seeking behaviors that could be legal or illegal, and also despite harmful consequences. So losing job, going through their bank account, stealing from other people. And so those are what we typically label as addicts. And so when we look at our current population here in our clinic and across the country, research says that less than 2% of sickle cell patients are actually addicts or substance abuse people who are actually using illicitly. And so somehow, some way, we're constantly trying to get the message out of saying that they're not drug seeking, they're in pain, and they need to be treated so that way they can go back home and go to work and have families and enjoy a quality of life compared to others.
Right, right. And I think it's so, with sickle cell, it's so many layers when we even
Hmm.
talk about treatment, because I know just as a clinician working with a client with sickle cell, we have to look at the aspect of just the chronic pain, the depression that comes from
Yes.
the lifestyle changing, from being in
Hmm.
chronic pain and people not understanding that, and family members and the time off from work. Then you have the level of the aspect of the stigma, the racial stigma of going to the hospital, that whole chronic, discrimination,
Hmm.
and the relapse that comes from that, and wanting to go to treatment, being judged again. Or even, as we have said in a lot of research, the past trauma, that has occurred within the body. When we talk about trauma, is not always it's life-threatening incidents, but when you deal with chronic pain, it is considered life-threatening in some aspects. So
It is.
I think what we were dealing with is, what is the set treatment that has found to be most effective. And I know most practitioners, we have to use an eclectic approach, because
Hmm.
one form of treatment is not, because you're dealing with so many layers, not including addiction and the
Hmm.
dependence on things. So what have you guys found to be the most effective? Would you say is diet, lifestyle? I know medication, there's different trials. What are you
Yes.
seeing as the most effective approach? I know combining therapy along with mental
Hmm.
health therapy and other things, but what do
Hmm.
you see as being the evidence based, and not just evidence based, from being a
Hmm.
part of the community and knowing what is working and what is not working?
So I would say our top three modes of treatment for those who have to have a treatment regimen. There are some who are living with sickle cell successfully, and they are on no treatment medications besides maybe ibuprofen when they're having a pain crisis. But on average, the common treatments are blood transfusions, blood exchanges, and the use of hydroxyurea. Hydroxyurea allows for the increased production of fetal hemoglobin, which therefore creates healthy red blood cells inside the body. And so many of our patients take that. What just happened between last August and December was a phenomenon. Two new medications just came out on, I'm sorry, two new medications just came out. When it came to the treatment of sickle cell. And so, of course, I can't remember their names because they're a little bit complicated. But what we've seen with those two new drugs is that it's taken approximately 10 years since the implementation of hydroxyurea before these two new medications came out last year.
Mm, okay. All right. So I thank you for that. I'm gonna bring Miss Kiana Banks on now and have her share her story with us. Thank you, Dr. Watkins, on that. And I know it's one of the things, and being on the inside, and seeing what the people are going through, and sometimes not always having that exact answer or resolvement, can be hard in seeing that. The other thing I want to ask, what is it like for the staff that deals with this population and working with people that go through this chronic pain? Is it even from another side administrator, when you're working with an illness that may not be a cure, is it a different approach that you as a practitioner have to do? I know also self-care, but how is it for those working on this side of things?
So unfortunately, we do deal with death and dying. We also do deal with patients' loss of their quality of life. So they may be working, and then next, they may have different forms of deformity. So we have to make sure that as various practitioners working with sickle cell, I'm sorry, hold on one second.
Mm-hmm.
Constantly busy, so I apologize.
No problem.
We have to make sure we debrief. Last year, just guesstimating, we lost, I think, 7 patients, and which is difficult because when we look at the statistics across the country, the population of patients that we deal with that have at most higher risk of mortality is between the ages of 18 and 27. These are our young people. These are people that just really are starting their life, and they're highly more predisposed to various issues related to mortality, which can lead to mortality compared to the other age ranges. So last year we started having debriefings with our chaplains. We also make sure that if we need to, we will bring in EAP. We're doing whatever we need to make sure that we are actually going to be well enough to once again care for our patients. And it's due to being a practitioner of my own. I have a great therapist myself. I could not be a helper without once again having my own help too. And so we
Right.
have to be very realistic. I've cried, I've wept, I've been angry, I've asked questions to my higher power God of why. But I've also learned that I had to reach my own place of understanding. And also, as one of the clinicians often said here, I have to sometimes wipe my face before I go into the next room, because each patient
Mm-hmm.
deserves 100% of me when I'm going in there to work with them. And I can't take sometimes the grief of the previous patient and the grief of the other patient with me as I'm trying to treat them.
Right.
So we're learning day by day. And sometimes you can just see, even during regular lunchtime, we'll be sitting in someone's office or in the break room and, just talking about the patient and reminiscing on the good times of our patients. So we do whatever we have to do in working with the population that unfortunately deals with death at times.
Right. Thank you. Have a question here that somebody asked. What is the difference in blood exchange and blood infusion?
So it's blood exchanges and blood transfusions. And to be honest, I'm not going to even attempt to try to answer that question because I don't know. I would actually have to go ask one of the providers that question. But since we're talking, and I know Kiana will come on, I will text one of our providers while I'm here, and so I can get a very simple answer to that, so that way I
Okay.
can answer that question for you.
Okay. And so, and help me explain this. The whole purpose of the blood transfusion is because the blood is in their body, is taking the wrong shape, and that's causing pain. So the blood infusion is to help reduce the pain.
Almost, yes. So
Okay.
the blood transfusions are blood exchanges, is to take blood out and put blood in. And so we're doing that because we're also trying to take out the sickling red blood cells and put in someone else's healthier red blood cells that we're getting from a donation. And so with that, we're once again hoping to reduce the current pain crisis by giving them a larger amount of healthy red blood cells inside their body compared to the current concentration of sickling cells inside their body.
Okay.
So it is to hopefully reduce pain. But in long term, most of our patients have what we call blood transfusions on a systematic basis. They're getting it either monthly or bi-monthly as also as a preventative measure. We're trying to prevent them from going into pain crisis also.
Gotcha. Gotcha. Deep. All right. I'm going to bring Miss Kiana onto the scene. Hi, Kiana.
Hi.
How are you doing, my dear?
I'm good. I just put my cat down. So
I'm
brushing.
loving that painting you just put there. That's
Yeah,
beautiful.
it's the
That
sickle cell symbol.
that says a lot. It really does. It
I
really says
believe
a
that.
lot. Beautiful, beautiful. So we have Miss Kiana Banks, and I want this beautiful being to share with us her journey. As bright as she is shining today, she has had some moments of darkness, and we've been working in treatment wise and spiritual and physical modalities, and to assist her on her journey. So great progress has been made, and I just want her to kind of share the joy. This is not a story that we often hear in the media a lot about people's journeys that we need to be more aware of. You know, we never did even talk with about those who are carriers and carry the trade, and understanding that aspect. But Kiana, if you can just share with us, I would say, when do you remember the pain beginning, and when were you first diagnosed with sickle cell?
So, I have both my parents carried the trait. And so basically 4 children from 2 parents with the trait, both parents carrying the trait. One child has the full 100% ability to have full-blown sickle cell. One child will have absolutely no sickle cell trait at all. And then the other 2 have the strong possibility of both being trait carriers. So that's how that works. I happen to be the one child that both my parents had and got full-blown sickle cell. And I remember my mother told me that she found out that I was full-blown sickle cell when I was born. They told her when I was born. They did blood work. Guess they come in a few days later and tell you. I had the same thing with my daughter. I found out, had blood work done, and found out after she was born. I get a letter in the mail, and she's a trait carrier. So yeah, I did hear. I saw that Kelly asked what an exchange is. What's the difference between an exchange and a transfusion? I had my first sickle cell crisis at 5 years old. I was outside pushing my baby in a little stroller. You know, I was always small, skinny, as you guys can see. I was always petite, but that's not every sickle cell patient, and people think that all the time. Oh, he's so skinny, there's something wrong with you. No, I'm just skinny. But, pushing my baby, and I think I fell. And I think the shock from the fall and everything, it sent me into pain. And it was the worst pain I had ever felt. And so we go to the hospital, and they literally said, I literally almost died this night. And I remember my mom, she would always say that, this was the night that we didn't know if I was going to make it. And then from that night on, I don't think I really had too many crises after that until I was in my teenage years. And I think I had one maybe every 2 or 3 years. Then I had 18, and it started to kind of pick up. I would have a crisis maybe every 6, 7 months. And then, of course, they tell us not to have children. I ended up having a child who, thank God, only has the trait, very healthy, nothing wrong with my baby at all. And then I want to say maybe some of my good health with her at that time, because it was like after I had my daughter. So basically my pregnancy was great. Pregnancy was perfect, no issues, no problems. But the night I was supposed to be induced, I went into crisis.
So you were having contractions plus having
a crisis.
Wow.
So they didn't know, when they wheeled me into the hospital, they didn't know where to take me. They were like, is this crisis or is this contractions? I'm like, it is both. Somebody do something. So, yeah, I had a crisis and got through labor and everything like that. But I want to say after I had my daughter, I want to say.
Hold up. I'm still stuck up imagining this pain. So even with that, at that time, you can't even take any other really type of medication because you're with child. So you're really having to deal with triple quadruple pain at this moment.
Yeah.
Oh.
So it was like menstrual, and I always had my crisis always would affect my lower half of my body. Sometimes in my arms, and it feels like somebody would wrap something around my body and was just pulling for life, squeezing me so tight as if my bones could possibly pop out. You know what I'm saying? Like, and so your contraction pains are in your lower back, or they're where you get your menstrual cramps. So that's where I would get my sickle cell pain too. So they, in the middle of having that pain and sickle cell pain, they ended up just having to do a cesarean because I couldn't, continue to try and push and then go through the pain. I was going into distress. She was going into distress. It was just too much. So they ended up wheeling me all the way to the emergency room. But as I'm going to the emergency room, I'm still pushing because the pain is so hard. It hurts so bad. It hurts so bad. And it's normally screaming type pain, but okay, so doctors assume that that's how you are. If you're not screaming, you're not in that kind of pain. And that's not true, because over the years I learned to tolerate. After the pregnancy and going through that, I've been able, crisis after that, I'm able to just kind of, keep calm, be polite. I try and be polite because, as Dr. Watkins was saying, we do experience racism and, things like that. And they also, they say Black women, they could take the most pain, you know what I'm saying? For some reason, I'm like, please, somebody help me. But, so they feel like if I'm not screaming and crying, then I wasn't in pain. And, that doesn't mean that at all. It just means I've been able to deal with it. But Kelly was asking, a caller was asking about the exchanges versus the transfusion. So in my teenage years, when they saw that I was having these crises, I had one at 14 years old. And when I had this one at 14, it was like migraines. We were in church and my mom thought I was shouting. And I don't know if I got excited. I'm not sure what it is. I've learned that getting excited, getting very upset, extreme feelings of emotion would bring pain on for me. So I'm in church and I flip out because the back of my head was just killing me. It was hurting so bad. So we go to the doctor and find out that I was having strokes. So those sickle cells that were getting stuck, and we got blank blood vessels and arteries and stuff that go all over our body, right? Veins and everything. So in my head, this is happening. So now this is called strokes. I'm having minor strokes. And so my doctors at that time in Winston-Salem, I want to say Dr. Christine Johnson and Debbie Boger, her nurse practitioner, very wonderful team in Winston-Salem, North Carolina. Very helpful. They started me on blood transfusions. So at that time, blood transfusion I was just getting blood from another donor, from anybody who goes and donates blood. I was getting their blood. I now am on a different regimen because what can happen with getting transfusions over time is a buildup of iron. So basically, our bodies, with our blood, makes its own iron. But then we're getting blood from someone else. We're getting double the iron. That iron has to go sit somewhere. So it starts to sit in our other body parts, such as your liver, your kidneys, your different places. It'll sit there and it's not good. So instead of doing transfusions all my life, I start to have exchanges now so that I'm not getting that extra iron. They do have treatments for the iron overloads, but that can happen. It happens over maybe 10 years. I have been getting transfusions. So now I get exchanges. Exchanges are where they are pulling my blood out at the same time giving me someone else's blood. So I'm getting a whole exchange. If that makes any sense.
Yes.
Transfusion is you're just receiving.
Right.
You're not giving anything out.
Gotcha. Thank you. Tell us a little bit about, your journey with the pain medications and trying to find something that works and the whole response you get at the hospitals, or just your journey of how long were you on pain medications?
So, I have been on pain medication as a regular pain management thing, I want to say since, well, it's something they definitely give you if you go into the hospital. They may not necessarily send you home with a prescription. If they do and you run out, then okay, that's it. You don't get more. But you get to a place where they say, okay, you're having regular chronic pain. You need to be on a regimen that you're constantly taking every day. I didn't get there until I was in my early 30s. And that's when I started to experience the worst part of my sickle cell. I think that I spent so much time in my life feeling normal and trying to behave normal and not really understanding sickle cell and taking it serious, because a lot of us we don't want to acknowledge that we have it. We don't want to tell people we have it. We don't want to live like that because it puts a lot of restrictions on what we can do. And it's stressful. So, things that people do to relieve stress, you can't do those things as a patient. So I think God was like, okay, listen, you need to understand what this is about. So I started to really go through things. I mean, pain normally, regularly. I think it also had a lot to do with the state of my life at the time, being very stressed out, about different things that I had going on. And so I began to take pain medication, and I was taking the equivalent that a lot of people my size don't take. I mean, a lot of doctors would say, oh, you take the amount of a big fat truck driver. And we're surprised that you laying here even talking to us. I've been taking this medicine all my life. You know what I mean? So my tolerance has built up. So I was literally at Dilaudid, which is equivalent to heroin on the street. I was on 4 milligram tablets 4 to 5 times a day. All day I'm drugged up. You know what I mean? For someone who does not take that kind of medication, but I'm walking around functioning, As a matter of fact, I can't function if I don't have it at this point, do you know? So, and it had gotten to a place where, exactly, I couldn't function if I didn't have it. So then when the whole opioid crisis hit, and so you start going to the hospital and they're like, well, we're not giving you that, especially the racist doctors or nurses that you have to deal with. I had a lady come into my room, y'all, and ask me what I take, what my doctors normally give me, what regimen I'm on. And I told her. This woman got up, walked out the room. She said, girl, please, walked out the room and slammed the door. I wish I would give you that kind of medicine. You asked me. This is what they're giving me. You know what I mean? This is what works. I'm getting drugs that now that I don't take pain medication anymore, when I start to look at these drugs and see all the stuff that I would get in the hospital, y'all, this was some hallucinating type stuff. I don't know how my body tolerated it, but it started to be something I didn't want to deal with, because it was difficult to get in the hospital, then to get a prescription for it, and to get a pharmacist to fill it, because of the type of medication and how much it is. Like, everybody is in my business now, and then I was even getting turned down on a prescription that's right here in front of you. They were, oh no, we're not filling this. We got to make all these different phone calls to fill it. It just got really, really difficult. And I was in a position like, I wish that I didn't have to take this medicine, because now I'm going to have to go through withdrawals, which is worse, which is going to throw me into crisis. And, I can't continue to function like this. So I had to do something. I had to figure it out.
So what has been your approach on this healing journey now? What has been the balance for you?
Well, I met you, you beautiful, beautiful, beautiful person. Y'all don't understand how beautiful this person is that we are blessed with right now. And I started to do the spiritual journey. I learned meditation regularly. I learned yoga regularly. Both those things needed to become practices in my life. At the same time, they started when I started getting my exchanges. This is a card here that they give you when you have an exchange. This is showing who gave you blood. If you want to contact them, say thank you, yada, yada, yada. But they give you that when you get exchanges. So I just wanted to show that, you know what I'm saying? I think it's really nice because you get about 6 to 7 units of blood. So that's how many people donated to me.
Wow.
Yeah, so that's pretty nice. But those exchanges started the same time that I started my healing journey. And when I started my healing journey, I cut out the major stressor in my life, which was something personal, and I cut out using Dilaudid. I didn't want to use it anymore. So if I was going to have to lay and make my house a rehab, that's what I was going to do. And that's what I did. And I started to meditate. I started to do yoga. Then this lovely thing came into my life called Reiki. And I did Reiki 1 certification, Reiki 2 certification, and now I'm a master. And that is being able to heal energetically, you know. And so I use that on myself. I use everything that I know. I use the ability to think differently, change my mental health is a big part of having sickle cell, right? And being able to overcome the different things that we deal with in sickle cell. When I mentally got into a better place, changed just like that. I no longer had to run to the hospital looking for somebody to treat me like crap so that I could get some crap into my system.
Right.
So that's what I've managed to do. And then with my wonderful team, and they introduced me to Dr. Watkins, and we started talking, and I started speaking my energy stuff to her. She started speaking it to me, and I'm like, oh, my therapist knows what's up. So, you know, it was just awesome. You know what I mean? And, you know, people think like, oh, you know, I don't want therapy. I'm telling you, when you have sickle cell, it's like the ego is ridiculous because you feel like you're walking around with cerebral palsy or something. You know what I'm saying? But nobody can see it.
Right.
So you're like, well, if you can't see it, I'm not going to behave this way. I'm not going to act this way. But, I'm in pain. And I get hold on. You know what I mean? Anybody in our life has to deal with it, you know, and it just is so much that comes with it. And so we don't want to talk to nobody. You know, therapy is not, because they always told me about, let's get a therapist. I'm like, I don't want to talk to anybody about this. But I swear it helped me. If I could rewind the clock, I'd do it all over again. It was so helpful to have that kind of support, you know.
Because it's one of those things nobody really understands what you're going through often to even know the journey, because they look at the outside, and that's what we always talk about. And that's part of what therapy does, is help. In therapy, you got to first take the layers off that you display in public to everybody. You know, not only the layer of having to, when you're in pain, of going to a hospital to portray this certain image, you know, or role to get treatment, then just in day-to-day life. I just want to ask you in general, how did it affect your relationships, Kiana, as you're dealing, because people don't understand when dealing with chronic pain, mentally, you have to self-check into a whole nother world, and others can take that personally. So in dealing with that and just dealing with self, did it change many dynamics of relationships?
Absolutely. The more I delve deeper into my pain management and having to take the pain medications all the time because I was in pain or now addicted to my pain medication, that stuff makes you moody. You're already moody if you are in pain. So then for you to take that and then you're moody from the effects that has, I lost a lot of good time with my family. Like I said, it kind of mentally took me down through some tunnels. And so my daughter had to experience certain things with me. Romantic relationships, I think, kind of suffered as well. Some friendships suffered behind it. Because I just wasn't myself. You know what I mean? As a matter of fact, I don't even think I really knew myself, outside of, okay, my disease and, do you know your life self? No, sickle cell is your life. So, you know what I mean? But, it definitely affects it.
Definitely.
Chemically, because you're dealing with, the chemicals that you're having to put in your body from medications, and then just being in pain and being secretive, not wanting to tell people things, because you don't want anybody to feel sorry for you. You don't ever want people to think that you're using an excuse. That was my main thing. Like, so I'm always striving to do something, and I don't want to tell people that I have sickle cell anemia, because they're going to think that that's an excuse. I'm using that as an excuse.
Yeah, I got it. That's really deep. I'm glad having a whole nother perspective of this. So Dr. Watkins, when you were talking about those that have the deaths, are mostly they're unrelated deaths, or is it related to sickle cell? Because what I'm getting is that the disease and the pain, is it what cause complications and other organs that lead to death? What is it that is really causing the death?
It's multiple things that can cause death. So there's a such thing as what we call acute chest. Kind of think of it as a very, very, very severe pneumonia, bronchitis combined together. Once again, can cause very significant diminishing of the breathing. That can happen, and if it's not treated with the right antibiotics, of course, somebody can go into respiratory failure. So again, it may not be a pain crisis. It can be anything derivative of having and living with sickle cell. So as Kiana stated, we have had people die from aneurysms, from strokes, from heart attacks, because as we have to remember that the blood goes throughout our whole body. And we have to remember that even though we're talking about organs or organ systems, we also have bones and joints and muscles that can also be affected too. So they sometimes have to have multiple surgeries for joint replacements. But when we talk about that 18 to 27, one of the biggest things that one of our providers talks about is 18 to 27 is also the years of finding self, the years of sometimes partying, the years of doing what a regular old young adult wants to do. But there are also some consequences to it. A night of heavy partying, which will make a normal, healthy person just be hungover, can cause for someone to go into a severe pain crisis that can sometimes be detrimental. It won't necessarily lead to death, but it can have some serious consequences. Being dehydrated for us is one thing versus someone living with sickle cell is a totally different phenomenon. And so when we look at 18 to 27, it's also we have to be mindful of behavioral contributions that also contribute to a higher mortality. So it's medical, behavioral, are the main two components that I can mention when we talk about that age range. And so that's from that, most comprehensive sickle cell centers, including us, have really started to create transition clinics and transition programs. So when the young adults are trying to get ready to leave pediatric care, we're wanting to meet them at pediatrics before they get here. So the two people in our clinic who is responsible for that is our social worker and also our health educator. So they will go over there to the pediatric clinic and meet the young adults, sometimes their parents. They also provide tours that's separate from their appointment, so they can know what does our adult emergency room look like, because it's going to be totally different once you leave peds to come to adult ED. As Kiana has mentioned, it's longer wait periods, for example.
Right.
And your parents can't typically speak up for you either. What does our clinic look like? Though the peds clinic may have multiple, what we call that multidisciplinary team, we typically have more. So we have a nurse, we have a social worker, we have health educator, we have a pharmacist, we have a nurse care manager, and you also have me, who's the psychotherapist. But right upstairs, we also have psychology and psychiatry. So we're a well-functioning team, and we try to once again pull in whoever we need to create that holistic program and treatment.
Thank you. Thank you. I appreciate it. Kiana, I know I have to acknowledge a lot of your artwork. Are you going to be starting your Paint Away the Pain workshops anytime soon?
Absolutely. I would, I'm looking for all opportunities to be able to extend this to other people. So the pain away is basically in my holistic journey, my health journey, I started painting. Painting was, very relaxing for me. I love doing it. I love just creating different things, and I'm getting better. But I also incorporate a chakra assessment meditation that I do in that as well. And that's basically walking you through different phases of your life. And it's opening up those chakras as you do that. And then you just take, images from your life and you paint whatever you want to paint. But the point is to go through those phases of your life so you can start to kind of look at it, have an overview, and then start to see where some things may have been life-changing for you.
Mm-hmm. Gotcha. Where can folks find you? Facebook, or what's the best way to reach out to you to find out more eventually about these classes?
Well, I am on Facebook. My company is Framed Incorporated. So I'm on Facebook. I am also on Instagram, creatively_key. Also Framed. You can just look in Framed Inc. But yes, I'm both of those places.
Gotcha. Thank you. And Dr. Watkins, if you could just give us some information or if someone was not a part of the program at Levine, how would they get a part? How would they reach out to you?
So I make sure I say the right number. They have multiple cards. So in order to get an appointment in our adult clinic, you will call 980-442-HEME, HEME, which is 4363. You typically will be connected to Mr. Terry Calicut. He is a person who takes in all of our names for patients who are trying to get transferred in to our clinic. I will say there is a slight wait list. However, we try to be conscientious of those who may be more severe than others, so we do take that into consideration. But right now, I think I have to go back and double check, but there's possibly for new patients a 2 to 3 month wait when it comes to that. And so, but again, if you're needing to come in for therapy, we try to make sure that I can be available for our patients. And my services for our patients are free of charge.
Gotcha. Beautiful. Thank you. I was going to ask you that. Is this grant funded or is this through insurance?
No,
the hospital?
No. It's just a part of when they designed the program, they knew that therapy was going to be needed. So I'm just built into the program just like the nurses are. There's no grants, there's no fees, and unfortunately the health insurance, what we call DPH insurance for sickle cell, does not currently pay for mental health. We're advocating and working on that too.
Gotcha. Well, thank you. I just have to say, Kiana, this just makes me, I already love you to death. I love you even more for your strength, mentally, physically. So to see you still shine and look, I'm going to get out teary-eyed. But thank you. And Dr. Watkins, thank you for what you do, for the community and for the health.
No problem.
So
thank you.
For being a part. Yes, thank you for being a part of this. And if anybody have any
questions, having me.
No, definitely, this is something that needed to be talked about, and we need this information in our community, and this is part of what it is, or how we can come together to those that are dealing with this, because with so many other, autoimmune, with that we're dealing with, that you put that mask on. So, again, things what you're offering, the painting, the holistic, along with, the other services, and blending together. And hopefully we can make a difference in this. So I thank you all. I appreciate you all, and look forward to continue doing work with both of you to help others dealing with sickle cell. So thank you. Namaste.
Thank you.
Y'all have a wonderful day.
You
You
too.
too. Thank you.
Mm-hmm.